Hey, Go Check Project fans and KBMD Health family. Welcome back to our temporarily new studio here with Dr. Ken Brown. Ken, we're still where we were at our last show.
We are, yeah. We're still homeless.
No van.
Nobody came up and gave us a van down by the river to do our podcast.
Same shirts. Hello. We have nowhere to go. So, what's up, man?
Oh, everything's going well. Things are, we're moving again. We got the podcast. Hopefully we'll be a little bit more methodical, at least using the temporary studio and putting some content out. Hopefully people reach out and give us some topics. We got to find a nice place where we can start having some guests come over. And this is nice. I think people would enjoy coming here.
I think they would.
Yeah. We'll start doing that again.
Just a reminder, don't do this. Don't touch the microphone.
Got it.
Okay. Paul loves that kind of stuff. So the next thing is we're going to tackle a topic that you and I don't necessarily always deal with very often because it doesn't come up in our universe with gut health, but hair loss.
Hair loss.
Something that people talk about frequently, especially males, but we do have something
Are you
else.
interested in this because you have so much hair that you want to lose a little of it? Because you have no issues with hair loss.
Not yet, but I could. And maybe others don't necessarily have to. That's kind of the point is nowadays people you got a lot of hair too. And by the way, Paul has a lot of hair. He's nodding. He knows he has lots of hair. He's gross, but.
Do you remember during COVID so I had a patient very handsome guy, and he was in his early 70s, and he grew his hair out during COVID, like a lot of people did.
Yeah.
Like you and I tried.
Yeah.
And he just had that Richard Branson, just white, just long.
Cool.
I'm like, oh, dude, I love your hair. He's like, I know. He's like, I didn't know my hair would grow like this. My entire career, I kept it high and tight. He's like, if I would have done this in my 30s when I had nice black hair,
Nice.
he's like, I think it really would help the dating scene.
Well, I mean, he made it kind of cool because I'm guessing it's white now.
Yeah, it's white. It looks so cool.
Now it's probably cooler like that.
When I tried to grow it out, it just kept getting bigger like a mushroom. It never really did anything.
I got a helmet head for sure. Well, so we hear people and they take things like finasteride or Propecia. And they do this in order to stave off more hair loss. But what do you think the exchange is? Like, what are you trading in? Almost everything comes with a trade-off, right? If I'm going to gain hair, what am I giving up? So what are your thoughts on someone taking finasteride? And you brought up COVID. Remember whenever it was mentioned to us.
Totally forgot about that. By Flavio.
Yes.
Dr. Flavio came on the podcast and explained this to us.
High concentrations of testosterone production could make people disproportionately susceptible to COVID infection, right?
He, on our podcast, when we did the FLCCC run where we had a lot of these doctors that were attacked during COVID, he published a paper describing that when he went through the ICU, he noticed that all the people that were really suffering from COVID, like on the vents at the time when they were doing that, so many of them had male pattern baldness. It got him thinking. He's an endocrinologist. So he did research on this and then published a paper about how that high testosterone levels being converted to dihydrotestosterone could, and he explained exactly how, but it does something about the spike protein binding to the ACE receptor, encourage that, which is why men were disproportionately getting sicker than women and so on and so on. And that was the time where he published it. And then in Brazil, there was a political candidate that brought him up.
Oh, yeah.
And then just because he was brought up, they raided his lab and his home just because of that, because he published a paper about COVID and possibly treating COVID with something that decreases DHT.
To help people.
Yeah. And he was one of those docs that got taken down in that whole, just if you're going to say anything but what the governments are telling you to say, you're just going off. Kind of like us getting kicked off YouTube that time.
Yeah, but they didn't come into my home.
No.
They just kicked us out of our studio. So. But again, the finasteride, the Propecia, if someone decides to take it, what some people are beginning to ask is maybe your hair loss isn't related to this culprit, DHT. You mentioned it a while ago.
Really?
Yes. Even though DHT could play a part in some pattern hair loss, it might not actually be the active culprit. It could be something else, and DHT is just assisting another thing to go along with it. So more or less, when someone takes finasteride, they're preventing the conversion of lots of their testosterone already. So let's just talk about it a little bit. So finasteride sold under Proscar and Propecia, most notably, but Proscar is used for benign prostatic hypertrophy. So
prostate.
Yeah.
Prostatic.
Yeah, prostatic.
Prosthetic would be like a fake limb. So like if you had...
Oh, but I didn't mean prosthetics. There's not a lot of cancer in those.
I have a fake prostate.
That's weird.
I have a prosthetic prostate.
But so BPH is what Proscar is typically marketed for, but Propecia is for the control of hair loss. And the problem is that it doesn't block the testosterone or the DHT specifically where it would go effective or be effective at the side of the hair follicle. It actually blocks an enzyme that's converting things into DHT. So DHT is dihydrotestosterone. And at least the scientists behind finasteride have made a case that they link overproduction of DHT to male pattern hair loss. The only problem is that I produce DHT and I don't lose hair, and you produce DHT and you don't lose hair. So there's definitely a divide amongst those who have hair and don't have hair. And males all typically produce a healthy amount, at least at some point in their life, DHT and testosterone. So DHT is responsible for your deep voice, an increase in body hair, an increase in penis and scrotum and testicular size, as well as sperm production. And it's what helps determine for the male where the body stores its appropriate fat. So these are all essential things that you need, certainly as a developing person, as a developing young man.
Interesting.
But finasteride will block, as I said earlier, dihydrotestosterone by the inhibition of this enzyme called 5-alpha reductase. Now, this enzyme is crucial for the conversion into DHT. However, it plays some other roles too. It is essential for brain function and mental clarity. Sexual function, mood, muscle building.
The actual enzyme, not the hormone that we're talking about. We're talking about the enzyme.
I believe
has a direct effect.
Yeah, the enzyme, according to this study, let's get to this little study here. It plays a couple of different key roles just in its own activity away from the conversion of DHT and let's see here. Okay, we got a variation of glycosylation of proteins. It's actually one of the potential biomarkers of certain malignancies, so I'm sure you could test for it if something were being overproduced. You could find it. But erythropoiesis. So erythropoiesis is the generation of red blood cells, which is what happens at the kidney level. And this is helping convert that so that you can have enough red blood cells to maintain the appropriate amount of blood flow. Seems pretty important.
Yeah.
If you're low, if you're anemic, then oftentimes people become depressed or brain fog if you don't have enough blood flow. Regulation of bile synthesis. That's up your alley.
5-alpha reductase does that?
Yeah.
Huh. I had no idea.
And then there's a few other small things. But the point is, sometimes you block one little activity for one, you want one micro result, but it's going to affect everything. And on top of that, you're dependent upon DHT to just carry out normal male functions. So you might be trading in, especially if you're a male, your ability to be a traditional, strong male and kind of giving up some of your masculinity just hormonally by taking finasteride to control hair loss. So then you're at this crossroads. Well, what can I do? If I don't want to lose my hair, I feel more attractive with my hair. Maybe I'm willing to make this trade-off. Well, maybe you don't have to make that trade-off. Maybe it's just something as simple as exposure, food, sleep, and different things like that.
I like where you're going with this one here.
So what can you do to break down the ideas of, I'm going to show this so you can kind of look over here at it, but the roles that stress and sleep and a lack of nutrients, toxins, inflammations, and heavy metals can have on someone's hair production, especially on their head. If you have poor sleep, If you're a big mouth breather while you're asleep, or you're untreated sleep apnea, you are definitely going to have an increase in cortisol. Now, we've talked about that when it comes down to people who end up having long-term unaddressed sleep apnea. They have an increase in cortisol. And when you know it, one of the side effects of having high circulating cortisol more than normal is that you build up plaques and you get blockages in coronary artery disease. Well, it's also going to affect the way that your body maintains its hair on your head due to the hair follicles. I think it has something to do with the blood flow at these small micro levels and maybe getting blocked off, and just you get little blockages, just like you do in your heart. You disrupt your hormone production. You decrease your growth hormone. So if you're lifting and you're wanting to get stronger and you're taking finasteride, you might actually be blocking some of your natural ability to maintain muscle mass, et cetera, by blocking growth hormone.
Mm-hmm. Eric, I had a really weird question from a customer.
Okay.
They wrote me and said, I'm very concerned that Atrantil Pro could be addicting. Is there any chance that you're actually hiding nicotine or caffeine in there? Because it makes me feel so good, I'm scared that if I run out, that I'm going to be addicted.
That's a crazy statement, but I'm glad they like it so much. But no, none of that stuff's in there. All it is awesome spore biotics and polyphenols.
Atrantil Pro, not addicting, but you're going to love taking it. KBMDhealth.com.
Nutrient delivery goes down.
Well, let me just clarify that.
Sure.
So the growth hormone, you're saying that there's a direct relationship of the 5-alpha reductase on growth hormone?
No.
This is strictly related to sleep. Yeah.
Strictly related to sleep and what it might play for your head.
Yeah.
And growth hormone, I think, helps maintain some of your hair on your head as well. Nutrient delivery, which is essential for the hair follicles to have the appropriate amount of nutrients in order for them to produce hair. And then you increase inflammation. Inflammation seems like it pops up everywhere, Ken, that we talk about next to anything. Inflammation is just going to make anything that was once normal abnormal. Mm-hmm. And so you want to be able to reduce inflammation. But if you have poor sleep, you're not getting at least, if it is an adult, 7 hours of sleep a night, uninterrupted, and you're not tossing and turning, et cetera.
I mean, I just did the bloating awareness day where they had reporters come in and ask me questions. And, the question is, what are some things that we can do for overall health? And I'm like, sleep. If you don't have good sleep, don't worry about doing anything else.
That's right.
Second is nutrition.
Yeah.
And then third is, exercise. And then below all that is all the other stuff that people do, supplements and everything.
I mean, quite honestly, if people diligently did the first three things, we wouldn't have this company. We wouldn't have KBS. There wouldn't be a need for that, because people would be able to maintain their healthy. I mean, this is things that your body wants. It wants sleep. It wants good nutrition. It needs you to move.
So we need to tell people to just drink a big pot of coffee before they go to bed, so they need to purchase Atrantil Pro because they feel bad.
As long as they do it on a blue light screen, that's what they need to do.
We're doing the exact, we're trying to convince everybody, as we have said before multiple times, it would be an honor that if everybody got healthy and we didn't need to have things for gut health, like
totally agree.
Atrantil Pro. So
the next big thing that contributes is heavy metals. So we even had Sherry Guess on, where we talked about heavy metal exposure, the events that happen around heavy metals, the way that it can affect your health. But it's a real thing. And you can get exposure to heavy metals through dirty water, poor quality seafood, conventional deodorants. This is something I didn't know as a young person, but they utilize, I think it's aluminum in deodorant for antiperspirant deodorants and stuff like that. So the aluminum, I think, blocks unnaturally the production of the sweat glands to be able to perspire. And then industrial. I'm sure you have people who work in various industries, metal shops, tires, whatever, coal mining. You're going to be around metal bits, or people who work in even a gun range. Our buddy Drew once got, he instructs a lot of people in firearms, and he even tested high for lead just from instructing so many people routinely in a closed area, in a closed range. But the heavy metals cause real problems because they disrupt enzyme pathways. They block nutrients from being absorbed by the appropriate cells. They can cause autoimmune triggers. Shout out again to Sherry Guest. She did a great episode on that with us on what happens with autoimmune disease and heavy metals. And then they specifically attack hair follicle integrity.
The heavy metals do.
Heavy metals do.
Wow.
The next thing is stress. If you have high stress, that's going to decrease follicular blood flow. That's exactly what the hair follicle needs to maintain good hair. Decrease in testosterone comes from stress. So once again, now you have finasteride on board. You couple that with stress, you're losing even more testosterone. An increase in cortisol, we've already covered that. Decrease in growth cycles. If you're trying to maintain healthy weight, you need good growth cycles because you need your muscle to be able to regenerate. And if you're decreasing your growth cycles, it's bad.
Which happens through the circadian rhythm naturally when you get into the different stages of sleep.
That's correct. And once again, stress results in a decrease in nutrient delivery. So what do we need to do to fix this? It's easy. We'd already said it. Sleep. Get some sleep. If you get sleep, some people even, I was kind of curious about this. Someone wrote in this article to consider mouth taping. Do you know anything about that?
I do it.
That means you know something about it.
Yeah.
Talk about it.
I'm trying to remember the book I read.
Is it duct tape?
Breath. No, I did what he said in the book. There's actually companies out there that make like specific ones, but he found that just simple 3M surgical tape. Mm-hmm. And so I keep it by my bedside. Mm-hmm. And so I just tape my mouth every night. And it's just, yeah. So I've been doing that ever since I read the book. He said he started doing it, and he said it was one of the important things.
Have you personally, number one, how long have you done it? And have you noticed any benefits?
I read the book a couple of years ago, so at least 2 years.
Okay. And you're still here, so it works.
Nestor. James Nestor was his name. James Nestor.
Yeah.
Breath, the Lost Science or something like that.
Mm-hmm.
Great book. That's one where he talked about like the skull shapes and how over time our jaws have changed and all that. That was that book.
Okay.
And he had a whole thing on mouth taping.
Interesting. Have you noticed a benefit for you specifically?
I sleep good. I've gotten to the point. I mean, I've got a little bite block that I have to put in because my dentist says that I was grinding my teeth, and so I've got to like a little routine, and it's almost like I don't feel like I'm ready for bed unless I start doing this little routine of mouth taping, mouth block, and bite block, and things like that.
I know something that you and I both do, and that is avoid screen and phone time within too much time before bed. We turn down lights. I mean, these are all just habits that I've tried to implement, and it's turned into better sleep for me personally. I don't know if you've noticed that. I mean, I use a blue light blocker on my phone, on my computer.
Yeah. What was that Danny Jones podcast, that blue light specialist that he had on?
Oh, yeah.
She was a little extreme on it, but it made sense because that was her whole thing, the photoreceptors, blue light, how it affects everything.
Then he also had on another guy. He came out with something I really would like to have him on the show, but he has a product called Daylight Computer. And Daylight Computer takes the old technology of what was it called? Palm Pilot and old BlackBerry.
Oh.
And they've advanced it. You know, the Palm Pilot technology was abandoned, but what they've done is imagine taking a computer and being able to go out into the sunlight right now. Like if you took this out into the sunlight directly in the sunlight would overpower your ability to read that. Well, so what they've done is they've been able to take the old Palm Pilot technology and they've improved upon it to where once you take something out, any website, it looks like you're just reading paper. And since it doesn't use blue light to emanate the image to you, it's not overstimulating. People, even with the same content, their engagement with their device or their computer is decreased significantly because the addictive quality around blue light draws people in. Yes, draws people in because of the frequency of the strobe behind it, making people want to engage with the device. Even sometimes, everyone, I mean, back up. Many times people feel like it's the doom scrolling is just because people want the content in this thread. They've been able to demonstrate that even more powerful than the content itself is it can send you into a search for content that will resonate with you because you're actually feeding off of the blue light triggers.
I did not know that.
Yeah.
Wow.
It's wild. So he had a follow-up with that guy. That's an amazing podcast, but I would love that guy on. They just launched Daylight Computer. They're going to come out with Daylight Phone so that you can watch YouTube on there. It just looks different because it looks like it's moving paper.
Wow.
It's brilliant.
What a trip. Wow.
Anyway, so sleep. The whole point of all that discussion was get good sleep. And then decrease your stress. You already mentioned it, breath with Nestor. It's all breath work. So begin with breath work, exercise, make certain that you're eating foods that aren't inflammatory if you want to control your stress. Make certain that your electrolyte levels and the metals that you do need, your magnesiums and your zincs, et cetera, are where they need to be. And then the last thing, they just recommended that if you can get your stress and your nutrition and everything under control, maybe there are some hands-on things that you can do. Scalp massage. Change out your shampoo. More often than not, if you can't pronounce all of the ingredients on your shampoo, just look at it. Just take out anything from P&G or any of the other mass producers. I mean, it just does not make sense what all is on there. Personally, I go to Natty G's and I pick up a particular bottle of Jason's shampoo that I like.
Okay.
It's all natural. There's also shampoo bars that are made all natural, but they recommended a shampoo that I had never heard of before. It's called Blue, BLOO shampoo. Again, just a natural shampoo that doesn't have harsh chemicals in it. I know that some people feel like they have to get certain things for shine in your hair, but when you back up and think about it, poor nutrition led to bad shine in your hair. Poor exposure or bad exposure to toxins led to the loss of shine in your hair. Not getting enough egg in your diet because it just, we're missing the right kind of proteins to give us this kind of shine and pretty skin that we want. If we just changed our nutrition and got good sleep, a lot of that stuff would return. And have you ever heard of derma rolling?
Yes.
Do you do it?
We'll talk about that in a sec. Derma, like the little spiky balls that people do for their face to increase collagen and stuff. Yeah, we'll talk about that in a second.
Okay.
But yes, derma rolling is supposed to, because it's really big in the facial, it's like micro trauma that results in increased collagen is what people have reported it for. And then they started doing it with scalp to try and improve the absorption of different things. Interesting.
Well, that's pretty much what they hit it. They said basically it's micro needling on a smaller scale. So, and the last thing that they recommended, and this one they backed up with a quoted study. Let me see if I can find it real quick. But they said that you can use rosemary oil and apply it directly to the scalp. And the interesting thing is, Ken, they included this study, which looks like the authors were Yunes Panay, Mohsen Tigazada, Elisa Marzoni. I don't know them. I don't remember meeting any of them. But the rosemary oil versus minoxidil, 2%, which is the topical, Rogaine.
Rogaine, yeah.
So that there was a comparative done between them in a random controlled trial, and apparently rosemary oil was just as good as the Rogaine. Not something that they say in their ad, but at least according to that study, that's something you could implement if you want to basically create a healthy environment for your hair follicles and not lose hair. So now back to derma rolling.
Well, okay, so just because it's GI, I get patients asking me all kinds of questions. And somebody was asking me, hey, I know it's not your field, but I'm starting to lose my hair. I don't really want to. Can you think of anything? And we talked about the typical lifestyle stuff. But then that led me down a rabbit hole and got a little AI involved.
Ken, what can people possibly do for one of the hardest things to treat, SIBO?
Well, one thing you can do is try our SIBO support box. Pre-packaged ingredients that help get rid of your bloating, get rid of the histamine response, clean up the small bowel, and actually help you sleep a little bit better. The SIBO support box.
Who doesn't want good sleep? Go to kbmdhealth.com today.
And there, what I came up with, where I'm like, I don't know, maybe you might want to try this, is that if you look at various natural oils, they can actually block DHT on a local level. without absorbing. And my buddy Chat came up with a combination in ratios of pumpkin seed oil, peppermint oil, saw palmetto, which is used for prostate health.
Yeah, it is.
And it is supposed to be a DHT blocker.
Mm-hmm.
Rosemary and licorice all work slightly different, but ultimately have been shown to have mechanisms to block DHT. And then take it up a notch. On the last episode, we were talking peptides. There's a peptide called GHKCU, which in the functional medicine community is used a lot for skin health and for hair.
Okay. Wait, just real quick, everything's topical that you're saying.
Everything's, well, okay, yeah. So, well, no, people use GHKCU. There's people will inject it directly into their head. They'll do subcutaneous for a systemic response.
Okay.
But in this particular chat, because I said, what is the best way if you were to sit there and do this? You're a hair growth expert, and it came back that if you were to combine those oils that I just discussed, and you can add GHKCU peptide to it, shake it up in a bottle, massage it into your scalp, and then micro roll it. So you're essentially shoving those, especially the GHKCU, you're micro rolling it into the dermis of your scalp right there.
Next to the follicles.
Next to the follicles. So that's why when you said, have you heard of this? And I'm like, well, I was looking it up for a patient that was curious about that.
Isn't it interesting, though, that let's say, and I do want to preface and say that I'm not claiming that DHT plays absolutely no role in hair loss. I think that it gets to a point, if I understood the article correctly, that DHT can promote hair growth, but certain things kind of put it on a pathway where it can also kind of flip and play a role of receding hairline. But it's interesting that the problem with finasteride is more or less all of the systemic effects that happen with taking it versus something just acting locally. And everything you just described is basically making it available at the site of action, at the point where it's needed most, not trying to change the body composition of the way that the hormones are functioning throughout the rest of the body, the rest of the processes, et cetera. You're literally only attacking where you need it most.
So let's talk about DHT for a second in relation to hair loss. And this isn't a topic that I've done a deep dive at all on, don't know a whole lot about it. But I remember watching, I don't remember, one of the podcasts, Mind Pump or More Plates, More Dates. Derek,
oh, yeah.
What's his name?
Yeah.
And he did bring up that a lot of the steroid stacks that bodybuilders do increase DHT significantly. And he said that's how come so many of these bodybuilders are bald. You look on stage, they're bald. But what's fascinating are these ones that have these great head of hair also. And including Derek, who's done cycles off and on, and he's got a great head of hair. So it has to do something with the ratio and your sensitivity.
Gotta be.
Maybe the 5-alpha reductase gets changed. This whole aspect that enzyme does more than just that one thing, blocking testosterone to DHT. So that being said, it is kind of interesting that it's not a one-to-one, because I think if you push your DHT super high, you're going to lose your hair, which is why so many bodybuilders do that.
Yeah.
Because DHT, I think, is one of the more potent muscle components of testosterone. So you can grow more muscle if you have a higher level of DHT, which is why some people grow muscle really easy and others have to work really hard. But that being said, so let's get back to what you're talking about Propecia, this 5-alpha reductase side effects. So, I mean, like you said that there's a trade-off for everything. So, like, what is something that somebody might experience?
From what I understand, it's just mostly the expression of male characteristics. I mean, if you're going to block that, then potentially you're not going to have the same performance of where you just said it yourself. DHT plays a large role in building muscle, maintaining muscle. Sperm count, I would imagine, would be affected if your DHT can't, because it's essential for spermatogenesis. So if you're trying to get pregnant, probably taking finasteride is a bad idea. And so there are those kind of trade-offs. However, it wasn't until, a rapid prep for today's show that I even realized that 5-alpha had any role in erythropoiesis or the command by the kidneys to then want to generate red blood cells in that role. So if you're anemic, I would imagine that you probably don't want to be on finasteride either because you've already got a low blood count.
Yeah.
So if someone who is anemic, though, we've experienced this just, with patients, your mood's terrible and you've got brain fog. And because you simply don't have enough oxygen carrying capacity. So if 5-alpha plays a couple of these other key roles, which of course nothing doesn't play a key role, then you're basically trading off some of the other aspects of health. And if it's just at root for hair, for vanity, maybe just making other changes will get you the result that you want without compromising some of the other stuff.
Yeah, I mean, that was the reason why that patient was asking me about that is because they were put on Propecia and he started to have decreased libido, erectile dysfunction, and he was having some mood changes, like some anxiety and some decreased mood. And so that's why he's like, I know that basically he was challenging me. He's like, I know that you like to do things more natural. Do you know of any natural way to do this? And I'm like, oh, let's learn together.
And I should have said that from the jump. I mean, erectile dysfunction is usually going to be the one right off the bat that would be the one that would turn people back. But yeah, that's associated. Because, I mean, if you're, not everybody, but if you're worried about your hair, it's because you're wanting to attract someone or you want to be attracted. And if you're going to pull them in, it doesn't make any sense to not be able to perform. So anyway.
You don't have to make love. Just feel my hair all night long.
Yeah. That's sure. That's what she's after.
That's really interesting. So it just comes down to that. Everything's a trade-off, right? But some people can take it and have great results.
Sure.
Others have, but it's the same thing. So it's just constantly in balance, and everybody's going to be different, which is why it's so hard to look at the data on these studies and say, oh, well, this is the predictability of it. But I do think that there is something also called post-finasteride syndrome, which is a little scary. In the literature, I don't know if it's like actively recommended or if it's actually studied a whole lot, but I do know that some people that have taken it end up for those same symptoms even after they stopped, which is scary.
Yeah.
So it's like a residual that can like last a year.
I would imagine, though. I mean, I guess you don't really quite know how long something could linger and affect a particular enzyme's performance. But I mean, you do something long enough, it changes the way that the body's had to adapt. It's missing this enzyme to do these kinds of things. Case in point, long ago we talked about ACE inhibitors and how people end up developing that dry cough, and it's basically just this leftover protein called bradykinin that builds up in the lungs, and people get this dry cough. Well, it doesn't happen right away. It happens over time because that little bitty protein builds up in the lungs, and then when they first stop taking the ACE blocker, it's not like the new ACE enzyme just comes in and cleans up the mess within a day. It takes a little while.
Yeah.
So there's a mess, in other words. And I would imagine that this is probably, at least in some way, similar. Just because you stop doesn't mean that instantly the next day everything's going to be fine.
It's really fascinating because when you talk about drugs that get searched all the time, your hair loss is something, I mean, you just see it. Commercials and commercials and commercials about hair loss and what to do about hair loss. And, there's supplements that people are selling like crazy.
Yeah.
And they go online and they buy that for hair loss. Everything is a lot about that. And then, of course, the other big thing is erectile dysfunction. Those two things for men are the hot button issues.
Yeah. Well, if you're being honest with yourself, just make certain that you're starting with sleep and nutrition. And do you work out? Then great. Because I think those three pillars stand the best chance of letting someone find out if they're truly giving it their all to solve it naturally, where you don't have to now put yourself on drugs. And I don't care if it's finasteride or whatever. It's very, very rare that we ever encounter a medication that doesn't come with some trade-off. And long-term chronic use of a medication is going to change some type of operation in your body. It's designed to do that. So just because it's going to hit a measured desired result, regrowing your hair or hanging on to hair, doesn't mean it isn't coming with a compromise somewhere else in your body. That's kind of the point.
Yeah. I think it's really interesting. It's fascinating with that 5-alpha reductase that it does more things. The enzyme itself affects other areas.
Yeah.
That's so interesting.
Well, I mean, but again, just utilizing ACE itself. angiotensin converting enzyme is what it stands for. And they created ACE inhibitors in order to help control blood pressure. But they didn't, they left out the factor that bradykinin is a protein that literally gets is designed to be processed and broken down by that exact same enzyme in the lungs, having nothing to do directly with blood pressure, the desired result. But blocking ACE prevented that protein from being able to be digested, and now they cough. So I would imagine that most enzymes have more than just one targeted function. Maybe not.
Yeah, that's true. I didn't even think about that, comparing that. Why would an enzyme? I would just think of it as something that helps a reaction take place.
Yeah.
You know, the substrate with the enzyme can become something else. But yeah, if it's floating around doing stuff.
What you would call it? Monoamine oxidase. Monoamine oxidase doesn't just only work on breaking down one catecholamine. It actually does a bunch of different ones. Whenever they get into the neural junctions, like, it does serotonin, it does norepinephrine. It does a bunch of different aspects like that. So blocking monoamine oxidase comes with a price of I don't know, more or less. A lot can happen. You have norepinephrine that doesn't get digested. You have, or not broken down, or whatever, or dopamine and serotonin. You could think that you're just going to control one thing and allow serotonin to proliferate in a particular area, but now you're changing the way that the body utilizes norepinephrine.
Yeah, you got me thinking, because that's MAO inhibitors. There's a warning on do not use if using MAO inhibitor.
Exactly.
Do not use if using MAO inhibitor.
So what the point is that a lot of enzymes have multi-purpose functions, and I would imagine that 5-alpha is going to be the same.
I'm even trying to think of what a brand name that is still being used. I don't know of anybody that still uses.
Well, in 5-alpha specifically, if 5-alpha is being blocked, you know what, Ken? I wonder if 5-alpha being blocked and the fact that it plays a role in bile production wouldn't lead someone to develop, and I have no idea, I've not looked this up, but digestive issues, reflux problems, digesting fat while they're taking.
Depends how sensitive they are. Yeah. Yeah. I think it's just going to be a spectrum with this.
Sure.
Some people can tolerate a little bit of DHT with no issues. Other people, a little bit, it's going to cause a hair loss. It's interesting.
Yeah.
Look at you going down the hair loss pathway. Nice. On a gut show. I love it.
Yeah.
And still tying it into the gut.
You know what else we did? We did it under 40 minutes. Paul. So.
Well, that's awesome. So here we go. We learned how to maintain our hair, both topically, watch out for the drugs because of the potential side effects, and everything comes at a cost. But a lot of people don't want to go bald. So
yeah, you should have a choice. Now you kind of know where to look. That's pretty much it.
That's awesome.
Thanks a lot for joining us on the Gut Check Project. We will see y'all next time.
Thank you very much. Take care.